Hello, this is Rachel Kelly, and I am sharing my week six discussion post. My topic is pancreatitis. An overview of pancreatitis. The word pancreatitis ends in itis. This indicates that this is a disease of inflammation, and its organ is the inflamed organ in this case is the pancreas, which is a gland. It's part of the GI tract. It has two primary functions. The first is related to hormones, and the other is enzymes. So the hormones it releases are insulin and glucagon. This controls how the body uses food for energy. And then we have the digestive enzymes that should be, in a functioning pancreas, released to the small intestines to aid the digestion of food. What happens with pancreatitis is these enzymes are obstructed from leaving the pancreas and end up attack the tissue of the pancreas itself. This causes the inflammation, and if it is chronic, it can cause necrosis of that tissue. So pancreatitis is often caused autodigestion, and autodigestion in this case is synonymous with developing necrosis due to the enzymes eating away at the tissue of the pancreas. It may be acute or chronic. Acute, by definition, lasting a short amount of time, caused by a specific event or incident. Chronic usually begins with an acute incident and becomes chronic. So the symptoms for both include ab pain, nausea, vomiting, fever, difficulty breathing. But for chronic, you're also going to see weight loss and changes in your stools, and you're going to notice changes in your ability to eat and drink without pain. Common causes of pancreatitis, we have 80% of cases are found to have alcoholism as a factor. Alcoholism is more commonly associated to men, to the cases involving men. Women seem to be linked more often to biliary tract disease, which has a better prognosis than alcoholism. So the range of symptoms for this disease can be mild to life-threatening. Mortality is linked to the amount of necrosis and potential hemorrhage. And treatment, whether it's acute, chronic, mild, or severe, usually requires hospitalization. When forming a nursing assessment for pancreatitis, you're going to do a pain assessment. The ab pain is a major symptom. You're going to assess the musculoskeletal status, especially in regards to weight and muscle tone and mass. Integumentary system for bruising, redness. You're going to evaluate the nutritional status of your patient and any increased metabolic requirements. So if a patient may be anorexic if they're experiencing pancreatitis, or they may be consuming the normal amount of food adequate for their typical diet, but due to the pancreatitis, they're having a nutritional deficit because the nutrients are not being absorbed as they should be in the digestive tract. You're going to assess the respiratory status. Pancreatitis is one of the two main causes of pleural effusion. The chemical changes that pancreatitis causes to your body can injure the tissues of the lung. So maintaining proper respiratory functioning is going to be a major concern for a patient with pancreatitis. You're going to assess the fluid and electrolyte status and the sources of loss. That would be nausea and vomiting, which are common symptoms. You're also going to, it's listed here as well, but you're also going to continue to refer to and observe the results of routine and ordered lab work. You're going to assess the abdomen. Board-like rigid abdomen is very common with pancreatitis. You're going to assess ascites. Hyperactive bowel sounds in all four quadrants are often found in pancreatic patients. Cardiac status is going to include tachycardia and hypotension. If those are found in a pancreatic patient, it could reflect hypovolemia, and shock is a risk, which is life-threatening. So typical diagnoses for pancreatitis include acute pain, risk for deficit fluid volume, imbalanced nutrition, risk for infection, deficient knowledge, ineffective breathing patterns, and imbalanced nutrition, less than body requirements. So the acute pain is related to arising tissue damage. It could be slow or sudden. You're going to potentially have deficit fluid volume. This could be due to the vomiting or potentially gastric suctioning, which could be necessary for the pancreatic patient suffering from pancreatitis. Imbalanced nutrition could also be related to vomiting and potentially the anorexia or loss of digestive enzymes and hormones related to the pancreatic dysfunction. Deficient knowledge could be a nursing diagnosis, especially for chronic patients or for acute patients that have lifestyles and diets that indicate a need for intervention and a lack of and some education on how to avoid repeating cases of pancreatitis, repeating flare-ups. The breathing pattern is related to pleural effusion, and you're also at risk for an elevated diaphragm due to the organs moving about in the cavity when the pancreas is swollen. There's only so much space in the body. Imbalanced nutrition, also related to the inability to absorb the nutrients from food. Listed there are some specific observations you'd find while assessing your patient for that diagnosis. So after after assessing and diagnosing your patient, you're going to begin to plan care. So depending on your diagnosis, you're going to choose a plan. Your plan, these are examples of plans. They are related to either pain, nutrition, respiratory function, fluid and electrolytes, and education. And these are just potential examples, but also priorities for a pancreatic patient. For a patient experiencing pancreatitis, nursing implementations for a patient with pancreatitis, you're going to monitor vitals. They're going to be ordered to be monitored per protocol or physician. This is going to likely include having a telemetry order or a constant O2 sat measure. You're going to be looking for tachycardia, hypotension, fever, and you're going to be monitoring the respiration and O2 saturation. So we're going to frequently be assessing pain and medicating it accordingly as ordered. The semi-Fowler's position is good to decrease pressure in the abdomen and diaphragm, which not only relieves pain, but helps in implementing an improved breathing pattern, which is our next point. We're going to improve the nutritional status, change of diet, and we're going to want the patient to be taking a high-carb diet, low in fats and protein between attacks. During attacks, your patient will likely be NPO. We're going to maintain skin integrity. For certain patients, this will be repositioning. We're going to administer medications as ordered. Antibiotics might be indicated for infection and insulin related to the pancreatic dysfunction. We're going to assess for fluid and electrolyte balance changes, so monitor skin turgor. We're going to want pink and shiny mucous membranes and document otherwise. Strict I's and O's. Patients at risk for fluid retention, excess output, and dehydration. IV hydration is often ordered at the onset of the disease, so we will administer that. We're going to provide education related to changes that will avoid a repeat of this inflammation. So patient may need referrals for additional help to quit drinking or smoking. We're going to establish a healthy diet and exercise program that they feel comfortable adopting and encourage optimal hydration. We're going to continue to monitor our labs, and this does include doing regular finger glucose checks. And lastly, if the dietary changes for nutritional status aren't effective, we may need to implement parenteral nutrition. When evaluating, we're going to address our decided diagnosis and the effectiveness of our interventions within a set amount of time. So for this, it means we're going to, for example, client has relieved of pain or discomfort at a 0 to 10 on the pain scale by the end of shift. So we have the goal, the evidence of the goal, and within a certain time period. And we're going to make sure we do that for all of our evaluations, which are based on particular diagnosis. Thank you.